Got to do it as fast as we can. So today we're going to be talking about tuberous sclerosis, or TS. And tuberous sclerosis, this tuber word is the word for potato. So a tuber is like a root vegetable. And so these tubers can appear inside your head, and they can be intraventricular and subependymal, and that's what's giving the name tuberous sclerosis to the disease. It's a phakomatosis, and what that means is mother spot, mata, phaca. So that means it's one of these conditions that's a systemic disorder that is characterized by cutaneous manifestations as well as intracranial and intraocular. So the skin, the eye, and the brain are linked together in all of these phacomatoses. And so when we have the tubers, you've got this subependymal nodule tuber, that is the tuber of tuberous sclerosis, and that means the patient's going to have seizure disorder, mental retardation, and other neurocognitive things from the intracranial manifestations of the tuberous sclerosis. It's genetic and it's autosomal dominant, so you got to ask about the pedigree and the family history. And the cutaneous manifestations are, it makes a ash leaf spot, which is a hypopigmented macule. So it's different than the cafe au lait spot, which is a hyperpigmented macule. So it's a white depigmented leaf. So don't use the leaf shape to define the ash leaf. Even though it is shaped like a leaf, it is a hypopigmented leaf. Otherwise you'll get confused with cafe au lait spot, which also looks like ash leaf, by the way. So the other cutaneous manifestation that we're looking at in tuberous sclerosis is this adenoma sebaceum, which is neither adenoma nor sebaceum. These are hamartomatous lesions that appear on your face. So it's kind of like the malar rash distribution. Adenoma sebaceum, we call this. And the shagreen patch. So the shagreen is like a type of fabric, and it's got these little pebbly texture to it. The shagreen patch is the other cutaneous manifestation that we should be looking for. And in the eye, the things we're looking for in tuberous sclerosis, they can have papilledema because you have hydrocephalus, because you have intracranial tumors and intraventricular tumors and obstructive hydrocephalus. So we're going to be looking for the intraocular manifestations of that. And then the benign tumors that can affect your heart, your liver, your lung. These are also hamartomatous lesions. So you should know a little bit about tuberous sclerosis. It's a phakomatosis. It has both cutaneous, intraocular, and intracranial manifestations. It's autosomal dominant. You're going to look for the hypopigmented macule, the ash leaf, the shagreen patch, and the adenoma sebaceum.